In part 3 of Getting Ready for Your Birth, we'll talk about the immediate postpartum for both you and your baby. Right after you deliver your baby, you'll experience a rush of oxytocin. This is the hormone that not only starts labor by contracting the uterus, but it's also the hormone that helps you bond with your baby and fall in love. You may have some shivering. This is a side effect of adrenaline in the body. It usually goes away within the first hour or so. Your uterus will begin to contract immediately after you deliver your baby, and then the placenta. This helps contract the uterus back to its pre-pregnancy size. You may also receive a medication through an IV called Pitocin. This helps speed up the process of contracting the uterus and helps to prevent heavy bleeding. It's important to spend as much of the first hour or more with your baby, skin to skin. This is called the golden hour. It's important for promoting breastfeeding and an easier latch, brings milk in faster, and it's really important for soothing your baby. Finally, you'll have some heavier bleeding for at least the first 2 to 4 weeks postpartum. This is called lochia. It starts like a heavy period and will diminish over time. You'll need to think about the recovery required from either a vaginal delivery or a cesarean or C-section delivery. First, with a vaginal delivery, if you do need an episiotomy or you have any natural tears, it's important to keep this area clean and dry, especially if you have some stitches. They may give you a peri bottle or a squirt bottle at the hospital that you can fill with warm water to use every time you go to the bathroom. You might also get a prescription for a gentle laxative that keeps you from straining when you do use the bathroom. If you have some cramping from the contractions of the uterus, you can take something like Motrin to help control any discomforts, but this usually goes away with time and may be stronger when you're breastfeeding. Make sure to take care of your breasts and get help from a lactation consultant at the hospital, or let your maternal health advocate or provider know if you have any questions or concerns. It's very normal and common to see some engorgement or swelling of the breasts, especially around day 3 or 4. Frequent breastfeeding or pumping is going to be really helpful for minimizing discomforts. Mood changes are also really common postpartum. Starting in the first couple of weeks postpartum, about 85% of women have what's called baby blues, a mild form of depression where you may feel sad, a little bit disappointed, perhaps antisocial. This usually goes away, again, within the first couple of weeks or first month or so, but if it becomes more severe or it continues to last, notify your provider as soon as you can. Finally, sleep deprivation is real after delivery. You'll be waking every few hours to feed and care for your newborn, so make sure to rest, take naps anytime that you can. After a C-section delivery or a cesarean delivery, there are a few additional considerations. It's normal to have some numbness and a little bit of discomfort around the cesarean incision. At about 2 weeks postpartum, you should see your surgeon or someone from your obstetric team to take a look at the stitches and make sure that everything's healing normally. If you see pus or have any signs of infection, don't delay in notifying your provider. There should be no heavy lifting, anything heavier than a baby for the first several weeks, and try to cut down on exercise. So circling the apartment or walking around the block may be about as much as you feel up to until this first few weeks have passed. And really it should be at least 4 to 6 weeks of healing before you're doing much more than minimal walking, lifting, or stretching. There are some warning signs to consider after you deliver your baby. Heavy bleeding, which could lead to hemorrhage, is a type of bleeding where your body can't handle the amount of bleeding that's happening. That's something that is an emergency and does require seeing your doctor or even going to the emergency room for. If you have an incision or a cut that's not healing well, this could be a sign of infection. If you see any redness or swelling in your calf, or you have difficulty breathing, this is also potentially an emergency situation and could be a sign of a blood clot. If you have painful headaches or you have dizziness or change of vision with those headaches, this could be a sign of high blood pressure, also known as postpartum preeclampsia. This also requires attention from your provider. And finally, if you have a fever greater than 100.4 degrees Fahrenheit, this is often a sign of infection. There are lots of other things to think about in postpartum care for your first few weeks at home. It is important to get rest. This is not an easy thing with a newborn at home, but as much as possible, again, rest when the baby rests. And if you can get a spare pair of hands at home to help hold the baby while you shower or rest or have a bite to eat, you're going to be in much better shape. It's important to keep up a nutritious diet and to stay hydrated. So this is always important for your health. But to recoup a lot of the energy that you may lose after giving birth, it's important to get a variety of whole grains, vegetables, fruits, proteins, and many cultures have traditional foods that they rely on in the postpartum period. So this might be something that you could investigate with family members. There are certain foods that are known to help you with your energy levels. Gentle exercise is important, but again, wait a few weeks before you resume any kind of exercise like walking or gentle stretching, and talk to your provider if you have questions about the things that you should and shouldn't do postpartum. It's important to wait to have sex at least 6 weeks after you have a baby, and sometimes more. It's really up to when you feel ready for it. And finally, back to breast care. Make sure that you employ help from a lactation counselor, friend, a family member if you have any questions or concerns. It's important that you empty the breast frequently with breastfeeding or pumping so that the breasts fill back up with milk to maintain a good supply of breast milk for your baby. Your newborn is going to have some procedures done in the hospital as well. Again, it's important to focus on as much skin-to-skin time as possible in the hospital and at home. Your baby will have the umbilical cord clamped and cut, usually within the first couple of minutes after birth, but they'll leave a small little stump of the umbilical cord that will dry and eventually fall off within the first week or two. If you see any signs of infection that it's not healing, notify your baby's provider as soon as possible. In the hospital, your baby will get an eye treatment called erythromycin. This is an ointment that goes on the eye to prevent infections. Your baby will also get a vitamin K shot. This helps promote blood clotting in case the baby has any bleeding disorders. Your baby will get its first hearing test and may receive his or her first bath at the hospital. Though this is not required, and some people prefer to give the baby their first bath at home. In fact, studies show that by delaying baby's first bath by 8 to 12 hours at least, we see much better breastfeeding rates. So this is something to consider. If your baby is breastfeeding or breastfeeding and formula feeding, think through your feeding options before you give birth. So you can ask nursing staff to avoid giving your baby a bottle if it's important to get off to a good start with exclusive breastfeeding. Same goes for a pacifier. For exclusively breastfed babies, we usually recommend avoiding a bottle or a pacifier if possible for the first 2 to 3 weeks. Finally, more and more hospitals today are promoting rooming in, where mother and baby share a room at the hospital. We actually see that babies and mothers get more rest and are more successful with breastfeeding when they do this. If you do feel like you need some rest and need the baby to go to the nursery, you can certainly ask your nurse at the hospital. Again, we recommend breastfeeding, and the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months and continued breastfeeding for at least the first year of baby's life. But we know that this isn't always an easy decision for all parents, and it's not always possible for all parents. We want to support you either way, whether you're breastfeeding, formula feeding, or both. Do know that breast milk production is a normal part of the pregnancy. You will start to produce milk towards the end of the pregnancy, and you will lactate and probably cease the milk production after the delivery. This can cause some swelling, again, if you're not emptying the breast with much regularity. So get as much help with this as possible. Skin to skin is going to be really helpful for bringing in breast milk and for helping baby to smell and recognize the food source and latching. Some of the basics of latching included bringing baby belly to belly, meaning baby's belly is facing your belly. Baby's nose comes to the nipple, so he or she can smell the milk and have what's called a gape response, where they open up the mouth wide and gently bring their head back for a good latch. This will cause better milk flow for the baby and less pain for the mother. There are lots of different positions that you can breastfeed in, including sitting down with pillows or with support in a chair. You can bring the baby under the arm or across the body. You can do this lying down on a bed or a sofa. So take some time to find images or watch people breastfeed to see all the different options that will be available to you. And make sure you talk to your maternal health advocate about getting a breast pump if you're interested in expressing milk. Insurance companies will cover this, and we can often get one for you even before you deliver your baby.